Hi everyone, this is Abby Leofsky and Amanda Cole, and we are presenting on assessment for bilingual language exposure. So our population of interest is bilingual children, which includes both dual language learners and English language learners. So children learning languages at the same time, and then also children who learn English as a second language. It is important to have assessments for bilingual children because if a developmental language disorder exists, it would exist in both languages. And assessing in both languages helps us have a full picture of a child's language abilities. It is also important to have an idea of a child's exposure to both languages because it is a predictor of semantic and morphosyntactic language abilities. However, assessments such as these are limited. So why are these assessments so limited? As you can see on this slide, primary language assessments for languages other than English are limited because of the lack of trained professionals who speak that language, as well as the potential lack of understanding expected development for that language. Parent reports are considered a useful form of assessment for early first language and bilingual assessment because parents have information on the child's early development. Existing parent reports, such as the MacArthur-Bates Communicative Development Inventories, are valid. So, Paradis and colleagues ran a study on assessing one of their parent reports that they developed. So they wanted to develop an assessment for children who are English language learners that is not specific to one primary language. They focused on the development of first language because if a language impairment is present, it will be evident in both languages. Paradis and colleagues believe that information on a child's primary language ability, in addition to secondary language or English ability, will be helpful in understanding the full scope of a child's language abilities. Therefore, for the purposes of their study, Paradis and colleagues developed the Alberta Language and Development Questionnaire, or the ALDQ. The ALDQ is a parent questionnaire that includes 4 sections: early milestones, current primary language abilities, behavior patterns and activity preferences, and family history. The ALDQ is unique in terms of existing ELL assessments because it is designed so that it is not specific to a particular primary language. It uses rating scales instead of simple yes or no responses, and it includes a retrospective section of the child's early developmental milestones. In order to see if the ALDQ is able to correctly identify typically developing and language impaired children among ELL, they gave the assessment to the 2 groups, typically developing and language impaired, and examined whether the assessment was able to correctly identify the children in each group. Based on the results, there were significant differences between the responses on the ALDQ for TD and language impaired children. The chart here shows the means for each group from each section. There were large effect sizes for the differences between the groups for early milestones and current primary language abilities, and medium effect sizes for the differences between the groups for behavior and attitudes and family history. Based on the results, Paradis and colleagues concluded that the ALDQ can differentiate children with language impairment from typically developing children among English language learners. One limitation in the study is that it had good specificity but poor sensitivity. It's possible that the poor sensitivity of correctly identifying children with language impairment is due to the selected sample. It's possible that some ELL children in the sample were misidentified as language impaired, since there is an over-identification of language impairment in this population. Also, there is a need for future research regarding reliability and validity. Paradis and colleagues discuss about doing this by planning to select one language group, such as Spanish, and returning to the children's homes to gather this information, because currently they have no information on reliability and validity. And lastly, if you are planning to use the ALDQ, it's important to remember that the norming group is based on English language learners with an average English exposure of 18 months, so interpretations on the results would vary if you're assessing a child who is a dual language learner and learned both languages at roughly the same time.
A more recent study regarding assessment for dual language learners was published in 2016 as the Language Exposure Assessment Tool, Quantifying Language Exposure in Infants and Children. The study by Deanda and colleagues discussed the need and development of a reliable assessment tool to measure language exposure in children. Seeing as though the article by Paradis and colleagues lacked the reliability and validity necessary for their parent report assessment, this article can be seen in contrast as it works to create a scientifically reliable parent report. Deanda and colleagues stated 3 core purposes as seen on this slide. These purposes are defined in regard to their overarching goal to quantify language exposure in infants and children. To do this, the authors developed the Language Exposure Assessment Tool, also known as LEAT, and examined its cross-linguistic validity, reliability, and utility. Within the research article, Deanna and colleagues recognized the need to provide a reliable parent interview assessment for relative language exposure. They explained that in regards to bilingual language proficiency, relative language exposure is an important source of variability. However, it is difficult to assess a child's language exposure while obtaining reliable estimates of daily, weekly, and overall distribution of the input languages of the dual language learners. As referenced in the Paradis article, earlier work demonstrates the value of parent reports of exposure, such as the MacArthur-Bates, but there is a need to evaluate the reliability and validity of parent reports of exposure. As stated earlier, the authors developed the LEAT, which is a computerized interview-style assessment that requests parents to estimate language exposure. Overall, the goal of LEAT's development was to provide a standard measure that can be efficiently administered across settings, facilitate research on early language acquisition in dual language learners, and assist in clinical assessment. It yields an automatic calculation of relative language exposure and captures qualitative aspects of early language experience. The LEAT is structured into 3 major sections as shown in this diagram, portraying questions for the parents to answer. The format allows parents to report timing, frequency, and the amount of language exposure. Relative language exposure and vocabulary size at age 17 months were measured in a group of bilingual language learners with varying levels of exposure to French and English or to Spanish and English. During the study, the parents were given the LEAT and the participants were administered 2 measures of early vocabulary size, the MacArthur Communicative Development Inventory and the Computerized Comprehension Task. These were administered because previous literature demonstrates strong links between exposure and parent-reported vocabulary. So, by giving the participants these vocabulary tests, the authors were able to explore the criterion validity of the LEAT's measure of relative language exposure. And in the end, the LEAT demonstrated high internal consistency and criterion validity. Also, its calculation of relative language exposure explained variability in vocabulary size above a single overall parent estimate. The authors confirmed that the LEAT is a valid, efficient tool for characterizing early language experience across cultural settings and levels of language exposure. According to the authors, the link between exposure and language proficiency also held in the study because language exposure estimated on the LEAT converged with the measures of vocabulary size across French, English, and Spanish in young children, indicating strong criterion validity.
So to compare and contrast these 2 assessments of bilingual language exposure, the ALDQ focused on children who were English language learners. And then the purpose was to differentiate among these English language learners whether they were typically developing or language impaired, but this assessment included no information on its reliability or validity.
And in contrast, the LEAT assessment is a little bit newer assessment as it was developed in 2016. It focuses on targeting language exposure in dual language learners. So unlike the LDQ, which focuses on English as a second language, this is looking at children who are developing 2 languages at once. And as I said, it measures relative language exposure, and unlike the LDQ, the LEAT assessment has information and data regarding its reliability and validity. Both articles provide valuable information that can be easily carried over into the clinical setting. Since the LDQ shows significant between-group differences, this suggests that it has the potential to be used with ELL children from various cultural, linguistic backgrounds. The LDQ would particularly be helpful in a context where direct examination of a child's L1 development is limited or impossible, and also the LDQ could contribute complementary information to direct assessment. And in regards to the LEAT could be used and can be useful in clinical contexts based on its simple and reliable format for evaluating relative language exposure and determining whether language assessments and subsequent interventions should be conducted in one or more of a child's language or child's languages. After reviewing both articles concerning assessment of bilingual language exposure, Amanda and I have recognized additional areas that should be addressed. First, it's important to consider that parent reports could potentially lead to biased results or skewed results based on a parent's difficulty remembering specific information for their child's past language exposure. Additionally, one single parent report on language input may be insufficient to understanding their full language profile, and it should not replace measures of language proficiency since it does not assess language specifically. And naturally, it's essential to take cultural aspects into consideration, especially considering that the population of these assessments are typically from various cultural backgrounds.
So here are our references. Thank you all for listening.